coming to Wild Chiropractic for about 10 years now. I'd had quite a few lingering problems from a car accident. I literally went to the Yellow Pages, and once I started going with Dr. Andrews, that was it. That's where I stayed. She's very professional. She's generous with her time and her knowledge. She's just got all kinds of modalities and whatnot to draw on. Since I've been coming to Dr. Andrews, it's been fabulous. I have gotten so much better. I've been able to do a larger variety of things, and I've been lasting longer. You know, I can do them for longer periods of time.
I've been practicing since 1998, and so it's 12 years now. When I was younger, I was doing a lot of dancing and teaching dancing and was having some lower back problems. And so I had done the whole medical doctor physiotherapy route, and it didn't really do much for me. So a friend of mine had told me to go see her chiropractor. At the time, I had never heard of chiropractic before, so I was a little weary, but I went, and I was very impressed at how he went through everything with me, explained everything to me, did a very thorough exam, and within 3 visits I was feeling much, much better. We are a multidisciplinary clinic. My philosophy is I want to do whatever it takes to get the patient better. Sometimes I have limitations in what I can do, so I'd like to be able to refer them to other people that can help, and better to have them in our office so we can all work together. I have an acupuncturist here, I have a massage therapist, and I have a Reiki therapist, and we all work together to help the patients. As part of my treatment, I always do muscle work. I think that's very important. I do muscle work, and for some people who have chronic issues, tendinitis, repetitive strain injuries, I like to use laser therapy, which has been very effective at reducing pain and improving function and decreasing scar tissue. We also offer orthotics here. I'm a firm believer that your feet are the base of support for the rest of your body, and if your feet and your arches are not functioning properly, they can affect the rest of your body, your knees, your hips, your back. Initially, you'll come in and you fill out history forms so that I can go through that with you and find out what your issues are and why you're in our office. We go through a scan of your back to find out information about your muscles and your nerves. I do a full exam, so range of motion, orthopedic tests, neurological tests, see how your muscles are working, your joints are functioning, and your nerves are working. And then we do a foot scan of your feet to see how your feet are functioning as well. Usually on the second visit, I go through those scans with the patient so that they know what's going on, and we discuss treatment options basically. So some people choose just to come for relief care, and some people choose to come for what we call corrective care, and some people come for wellness care. So whatever your choice is the choice that's best for you and for me.
I have less headaches. I've noticed the difference in my posture. I had reoccurring heartburn. So I come for treatments for that on a very regular basis, and it does help significantly.
I got my pediatric certification. It's a 12-course certification, and I took it because I love children, and I love having children in the office. And the reason I took it was because there's a need for chiropractic and children, especially with things like colic, ear infections, those types of issues, and people are very surprised to hear that. Why do kids need chiropractic? But it's a very necessary thing. It improves their nerve function. Kids who get adjusted don't get sick as often. They're just healthier in general, and so I wanted to pursue that. I had a patient who came in. She had never been to a chiropractor before. She had been in a couple of car accidents, and she came to me desperate. She was in an incredible amount of pain. So we started working with her, and not too long after, she had said to me one of her goals was to get pregnant. That's what she was worried about with all this pain, was not having a healthy pregnancy and being able to have children. And after we got her out of her pain, she came in and told me that she got pregnant. So that was really nice. Nice to hear.